Well, a warm welcome to everyone, and good morning and good afternoon, depending on your time zone. And thank you for joining us for our second Workforce Wellness webinar, funded by the Bureau of Primary Healthcare and HRSA's Health Center program through a national cooperative agreement. My name is Katja, and I'm the Director of Clinical Workforce at the National Association of Community Health Centers at NACC. I am joined by my NACC team member, Beth Kujawski, and also my NACC team member, Gerard Jolly, as well as our colleagues Michelle and Mariah from the STAR² Center at the Association of Clinicians for the Underserved. NACC and the STAR² Center are national training and technical assisted partners, and there are 22 of those. And we are offering this webinar series through that special partnership. Thank you to Michelle and Mariah for hosting and moderating yesterday's webinar. That webinar was focused on the pillars of wellness and specifically on workforce well-being through innovation in physical space to support clinical team cohesion. It was presented by our health center colleagues at the Yakima Valley Farm Workers Clinic. Thank you to them. And it addressed the workforce well-being drivers of adequate resources, the work team, and supportive health center processes. If you were not able to join us yesterday, we hope you will find the time to listen to the recording, which we will be sharing along with the recording of this webinar today. Today's webinar will be presented by our health center colleagues at CMAR Community Health Centers. And it is my very true pleasure to introduce their team to you. Dr. Tyler Lawrence, he is the Medical Education Officer, Associate Program Director, and Residency Behaviorist for CMAR's Community Health Center's Nurse Practitioner Residency Program. Patricia Cleveland, she is the Nurse Practitioner Residency Programs Director, and Dr. Phil Riley, the Clinical Director at CMAR's Seattle Medical Clinic. You will really enjoy learning about their genuine commitment and passionate dedication to promoting workforce wellness and learning more about their workforce wellness program. We will be happy to answer your questions both throughout the presentation as well as at the end. And I'll hand it over to my colleague Michelle for a moment to go over a few housekeeping items. Thank you, Michelle.
Perfect. Thank you so much, Katja. So let's go into the housekeeping slide. I know all of us have lived in this virtual world for a long time, so I'm sure you know most of these, but just want to go through a few before we go ahead and send it over to our wonderful speakers. So the session is being recorded, and all of the recording and the slides are going to be provided to all of the registrants. So exactly as Katja said, this is a two-part webinar series. Yesterday we had Yakima Valley Community Health Center, an amazing health center, amazing presentation, and today with CMAR, I know it's going to be another amazing presentation. They're also an amazing health center. So all of that is going to be provided to all of you. Please use the chat box to ask any questions, share comments, or any thoughts. We are tracking the chat, so we're making sure that as they come in, we can read them out loud, or if more appropriate, at the end of the presentation to be able to ask those questions. If you are having any technical difficulties, Mariah Blake is your go-to person. So please go ahead and reach out to her and she'll be able to assist you. And then finally, as I'm sure you know, anything you attend, there is an evaluation that we would truly appreciate if you could fill out. Not only is this a requirement for us, so really important to be able to get that data, but also it helps us know how can we improve and what type of programming and training and technical assistance you're looking for and that we can bring to you. So with all of that said, and again, thank you to Katja and to NACC and the partnership that we have with them, I'm going to go ahead and pass it over to CMAR.
All right, hello everyone. Thank you for the introduction. I'm Tyler Lawrence. I'm CMAR's wellness lead. Next slide. All right, so we're going to cover a few things for you all today. First, we're going to get into CMAR's background, let you all know a little bit about who we are as an organization. That context can always be helpful. Then we'll get into some of our main wellness program components. We're not trying to be exhaustive, but just trying to present the things that we think might be of most interest to you all. Then we'll get into, do we have reason to believe that our wellness program is working? What did it take to successfully implement our wellness program? Some of our lessons learned over the past several years of our wellness program. But then also advice for you all. Thinking about setting up a wellness program, or maybe you already have one and you're just trying to learn some maybe tips and tricks. But I think maybe two things to think about as we get into our slides. The first one would be, so currently our wellness program is just for our medical providers. There's talks about expanding that, but right now it's for medical providers. And number two, again, kind of the way we've thought about this presentation is pretty much laying our wellness program on the table so that you can kind of see what it is, how we think about it, just to make it easier for you all to borrow components from it or realize maybe what you don't want to do at your organization, but just trying to be like, open up our brains and let you know how this works. Next slide.
Great. So this is my cue to talk about CMAR a little bit. So CMAR was founded in about 40 years ago with a group of community activists, really with that grassroots focus at the original site at our Seattle Medical Clinic, which is still standing, and has since then really expanded with nearly 100 clinics all along the I-5 corridor, from nearly the Canadian border to the Oregon border, and then west out to the peninsula. CMAR's mission is CMAR is a community-based organization committed to providing quality, comprehensive health, human, housing, educational, and cultural services to diverse communities, specializing in service to Latinos. I think the dedication to the vast array of services that CMAR provides is really remarkable and is, I think one of the reasons why so many of us work at CMAR. Next slide.
And so I'm just going to talk about how we got to the point of starting to develop a wellness program. So at CMAR, ever since the early days, we've had what we call our all provider meetings, which is a meeting of all the clinicians in the organization. Originally it was one clinic, but now we're 37 clinics. And we have those meetings twice a year where we try to bring all our clinicians together and have themes around those, with some sort of didactic presentations, as well as kind of organizational operational goals and discussions. And in 2019, seeing what was going on with the primary care workforce, we had a focus there around wellness and the flip side of wellness, which is burnout, that we are seeing something developing among primary care. And so we had a guest speaker who was a wellness, I don't know his official title, a wellness director, John Chuck from Kaiser in California, who came and gave a very inspiring talk about their perspective at Kaiser and their approach and things they could do to improve an organization's support for clinician wellness. And at that meeting, there was a very open embracing of that concept. And so out of there, the medical leadership and the organizational leadership started to say, okay, we need to think about incorporating this into part of our organizational structure. And that's really when we started to begin the work with Tyler and our chief medical officer and other elements of our medical leadership to get a vision of where we wanted to go and a vision of how much resources and how we would proceed from there. Next slide.
Absolutely. Still mentioned like commitments are just a big key to having a wellness program, key from the various stakeholders. But the next component we view as really an important part of our wellness program is assessment. And so what this means for us, since 2019, when our wellness program really got started, we've been doing an annual, what we call our burnout and professional fulfillment survey. Goes out once a year, usually in April or May, to our medical providers. And maybe just a few questions that maybe folks would want to know we ask a one question burnout question. Probably many of you know what I'm talking about. It's the most commonly one used. Question on maybe intent to leave our organization or reducing FTE. Maybe some open text comment boxes about, what do you feel like CMAR is doing well to promote your well-being? What do you feel like are greatest sources of dissatisfaction? But then some useful questions that we have too are we ask providers their level of satisfaction with various things we feel like are important for a medical department. So level of satisfaction with time spent charting, EHR effectiveness, level of satisfaction with clinical leadership, organizational leadership, amongst other things. And what this has really allowed us to do, we make tweaks to the survey year after year, but the bulk of it's the same. But it's been a really nice way to track changes since 2019 across time about how satisfaction or dissatisfaction or burnout has fluctuated within our organization. As you can tell, like this is, gives you data to do like a wellness PDSA cycle for your organization instead of solely relying on anecdotal comments. Anecdotal comments are important, but if you really want to see if those, if you've making that change to your EHR, you changed a vendor or this or that, you can actually, a lot of times you can see the results in the survey. So it's a nice way of showing if what you're doing is being perceived as favorable or unfavorable by providers. Maybe a few things about it too. For a lot of our wellness program stuff, we try not to be terribly inventive. We really try to borrow what others are doing and what they're doing well and tailor it to our own needs. And our burnout survey is no different than that. And I think year after year, actually, we get a phenomenal response rate. I think this year is actually almost 50% of our medical providers responded. And I think that really shows that providers see that this survey is important. It's a way for their collective voices to be heard, and that the organization is responsive, is aware of the survey. So, I think that's great. But also one thing we do, we don't just take the survey results and put them in a box and lock that box away. We really share the results at all levels within our organization. We share with our providers, usually at our all provider meetings, but sometimes do like a recording and send it out in one of our wellness newsletters. We share results with our medical directors, senior medical directors, our C-suite, and our board. So really, anybody who's, I guess, relevant, you can share them with. We do share our burnout survey results with. All right, next slide.
And before talking about EHR optimization, I just wanted to tag on to what Tyler was saying. That sharing of the burnout survey over time. So, one report goes to our senior leadership or to our C-suite, and they're like, okay, well, those are problems we've known about forever. We can't fix them or whatever. But seeing the report year after year and the trends and the engagement, that has been really, and we'll talk about this later, but in my view, it was one of the biggest drivers of keeping this going and moving it forward. And so when you think about the role of the survey, it is a slice in time, but it's actually value is not about the slice in the time. The value is about comparing it over time, going back to revisit it, and learning things more and more. Because every time you present a survey, it's normal for people to have the reaction, oh, that, people feel this way because, and just trying to explain it and understand it. But as it goes over time, it really hits home that, oh, this is actually a super important measure and a factor in our workplace that we need to think about and change and move forward. And so that value of the survey really does become more and more over time. One of the things, to jump to this slide, about that was identified is, as a lot of people know, in medicine and in primary care, especially, the role of electronic health records in either contributing or taking away from providers' sense of efficacy and satisfaction in their jobs. And so we recognized that early on, and as an organization have decided, when we've gone through 3 different electronic health records over the past 15 years at CMAR. In 2020, we went to Epic, and at that point formalize the role of having a dedicated physician leader, who is me, to guide our build in Epic with a vision of making it a tool that is easy to use and makes clinical care more effective and hopefully more enjoyable. Part of our role on that is that perspective about how we build. We're building things and delivering tools to our clinicians that hopefully remove the friction in their day about how to document their care and how to get decision support within their care. So a lot of really thoughtful attention placed to, is this necessary? Can we make this better? Can we make this easier? And part of that was putting the work in ahead of time. And when we delivered our first Epic, we had pre-built note templates with tools in them, rather than having individual users build all their own note templates. And as time goes on, we just try to make those templates based on feedback and based on changing needs, make those templates better and better. And we have probably, between 80 and 90% of users use those templates and the tools that we give. And so that's a very high penetration, which speaks to that they're easy to use, that people like them, and that not everybody wants to put in a lot of extra work to build their own personal thing, which is something that some electronic health records really try to push, is individual personalization. To do that, we have monitored, there are tools in Epic can give you views of how an individual user is doing, how we're doing as an organization in terms of how much time we're spending writing orders, how many orders have to be changed before they can be signed. So there's a lot of behind the scene within the structure work that we do. And we've, just as an example, for orders, when we first did it about a year under a build, it was something like 70% of our orders had to be retouched before they could be signed. And we looked at why that was, and it would be certain things like just like the number of refills was left blank instead of having a number in it and things like that. And so we cleaned that up and really reduced that to now it's about 30% of orders have to be touched or personalized. And so little things like that, the death by 1,000 pinpricks that can happen to providers. We really try to put a focus on it and make sure that we learn from our providers and how they're doing workflow, and then change our build to meet those things. Our trainers that we have kind of reinforce that message about using the structure, and also they serve as ears on the ground to hear back from individual clinicians and say, people find this part frustrating, or this is not working well, and we have a constant cycle of trying to improve it and make it smoother. As an organization, FKHC, we all know there's a lot of reporting requirements, and sometimes leadership can come in with a requirement that may not be intuitive to our workflows. And so having an EHR physician builder who is both a primary care provider and has a view of the informatics structure, I think is really important, so that you can say, no, we're not going to do this. You want me to, check this box on every patient, for example, for a report. And like, no, that's not an intuitive way to do it. It's a friction way to do it. Let's find a better way to do it. And that has served us well over time, is to make sure that you have people building your electronic health record and curating it who know both sides of the equation, both the documentation requirement side and the seeing patients and doing the work side. And that has been our focus on our EHR. Next slide.
So I think we have all seen, it's really hard to see patients 5 days a week in a community health center. And so bringing in some role variety has really been something that's been helpful for us, that our providers have really appreciated. I think with our residency and training programs, having an opportunity to precept and teach students has been huge. So we currently have training programs in 3 different counties, and so having experienced clinicians at clinics within those 3 county sites be able to come to the residency site maybe 1 day a week and teach the next generation has been really rewarding in terms of just 1 day you're doing something different, but it's also, preceptors have said they stay on top of the latest research. It's a chance to mentor and build those relationships. I think conversely, from the resident perspective, being intentional about the types of things that we're asking our preceptors to help with has been important. And so, using all the survey data and all the stress points in our workflows and trying to find ways to have our experienced preceptors mentor the residents to work through those, to build those good habits, like effective ways to efficiently, work your inbox, or work through Epic or sign a note, I think has been really important. And also conversely, if you have residents who are learning those best practices, they often share it with the preceptors, and then all the preceptors on those best practices bring them back to their home clinic site. And so I think it's been a great tool to really enhance everybody's quality of life, so to speak, around work. So other role varieties that we have are around procedures. So some residency sites have a dedicated procedure clinic. So for those providers who really like to do procedures, they're paired with a resident. It's a win-win because then the residents get the procedural experience, but also being open to pursuing training on specialty procedures. So being open to providers who want to do colposcopy, to CMAR has supported those folks to get trained, which then also brings colposcopy services to CMAR. And so, within community health, we see so many people who don't have access to specialty care, or there's a lot of barriers to getting to specialty care, a lot of mistrust. And so being able to do more of those things internally has been helpful and then rewarding for the provider team. And similar opportunities for providers to be part of our quality improvement team, clinical champions on certain topics. We have a lot of providers who are really passionate about certain areas and have pursued grant projects. Like we recently had a grant project related to HIV care that a provider championed and has really enhanced HIV care for all of the CMAR clinics or early childhood development. There's a few different examples of that. But I think having an organization who's open to those types of investments or just supporting providers who are taking that initiative has been helpful. And then leadership opportunities, having medical clinical directors at each of our clinic sites. Next slide.
All right, so another, I'd say, big component for a wellness program is leadership development. And we do this in a couple different ways, both internal and external resources. So external leadership training, I think maybe shout out to the Washington State Medical Association. They actually have a course, pretty intensive course on leadership development. They have like a once a year retreat on leadership development. And each year we try to continually get a variety of our medical directors to go, to eventually ideally get all of them to attend. Actually, this picture I included, we had 8 medical directors attend that year, and there's actually, I know you don't know them, but I can see like 5 of them right there in the little photo. So it's just fun to see that. And I think Phil, I think you went that year, but I don't see your photo on there. Maybe you were skipping. All right. Okay. So we also have our own internal leadership development. And again, we're thinking more this like for medical directors, so like the lead for each medical clinic. We call it the Applying Best Practices for Medical Directors. Happens about quarterly. It's been going on since, gosh, maybe 2021, 2022, somewhere thereabouts. And this was really a grassroots push by the medical directors to get this going. It came out like there's some medical directors that were new to the role. Maybe residency and a few years of practice gave them great clinical skills, but being a great leader and being a great clinician can be 2 separate things. So how do you get them used to being a leader in their clinic other than just trial by fire, which that can be painful? So really this is medical directors rotating, sharing a best practice on pretty much a topic of their choice, but it has to be relevant to the rest of the medical directors. Maybe a few examples include how do you support providers who are struggling with their charting and in-basket? How do you talk about and understand clinical quality measures in a way that's productive? Just a few examples there. Another thing we have is during the annual provider evaluation around December to March, thereabouts, the providers from each clinic are able to complete the Mayo Clinic Leadership Index on that clinic's medical director. And you can Google right now, it's fairly widely used. Basically, it is a list of, I think it's like 12 or 15 questions rating that leader, that medical director, on their use of various leadership habits. For example, do you feel like your medical director holds career development conversations with you? Do you feel like they treat you with respect? Are they open to your ideas? And things like that. And basically, it's a nice way just to give feedback for the medical directors. And actually, we try to keep it as anonymous as possible, because if you're clinic with one medical director and then one other provider, that's not quite anonymous. So we try to just, thank you, Katja. She put that in the link, or I think. But we just try to give that feedback to the medical director when there's 3 or more providers that completed the index on that medical director. So it gives a layer of anonymity to it. I think as Patty mentioned before, offering grooming new faculty members for training programs, but also for the faculty members and preceptors, we put on a quarterly, what we call a CMAR faculty development series. Again, it's a way to give a quarterly 1-hour presentation on a faculty development topic. Again, that can be how do you help residents that are struggling, maybe just tips on giving feedback and to students or residents and things like that.
So sorry, just to jump in again, it's my nature. For Tyler, just to emphasize again, the leadership development focus really came out of noticing both in the literature, but also in practice that a clinician who is in a context where they feel like there's not good leadership quickly degenerates into feeling like a cog in the machine or a victim of the system, however you want to put it. And it is really impressive to see how having good local leadership, listening to all clinicians and having them engaged and feeling that they have a sense of agency, because they do have a sense of agency, because they have a leader who's listening to them and interacting with the organization as a whole. It makes a huge difference. And we see it in our yearly evaluations all the time. You can see in a given clinic the strength of the local leadership reflected directly in each clinician's kind of expression about how they feel about their job. It really is very impactful.
Thanks, Phil. And I'll add before we go to the next slide, just to brag on our medical directors a little bit. So our Mayo Clinic Leadership Index, you can actually add up the scores and aggregate them. So our average medical director has X score. Compared to everything we found in either literature or online report, our medical directors are actually higher than anything I've seen online. And it's really kudos to them. And clearly, we're a community health center, they're very passionate about their work. They wouldn't be here or taking that leadership position if they weren't. So, but that's that's great to see that. So good work for them. Yeah. Next slide. Yep. Yeah, and this is kind of a catch-all category, maybe just called provider support. So a few of the things that we do a about monthly wellness newsletter for medical providers. Usually pertains to, as you can see this example from some months ago from last year. We're doing a NACHC co-pilot trial of AI scribe trial. Maybe things that have to do with wellness resources for medical providers. Sometimes it has to do with positive patient comments, giving shout outs to various medical providers. we actually get pretty good readership. About a quarter of our medical providers read each issue of our wellness newsletter, so that's good to see. Another is our associate support. I'll describe this one a little bit more in detail. So this is one where when medical providers, when they're having maybe a tough day, maybe adverse outcome or near miss, usually they like to talk to other medical providers about the challenges. Maybe they vent or just process or talk through the situation with specifically other medical providers. Now, let's say maybe you don't have that kind of relationship with another medical provider at your clinic, or maybe you're the only medical provider at your clinic. What do you do then? Obviously, that resource, having somebody to talk through, is really helpful, but it's not immediately accessible to you. Basically, in short, it's a way to connect providers and organization to another one of our medical providers at CMAR that has been trained in supportive listening, who will have those discussions. We view it as more like a, I think one of the providers that does this, he described it as like an airbag. Just knowing that it's there is helpful, and when you need it, it helps to it just helps. So it's my nutshell version of that. But maybe one thing to think about if you do want to start up something like that is talk to organizations in your local area that already have a program like that. So it really helps again borrow what others are doing. Another one, mentor program. So we have written into our orientation schedule the opportunity for new providers to be paired with a more seasoned CMAR provider and meet on a recurrent basis. I think it's like monthly. And that's just a nice way for the new provider just to, if they'd like, to get to know maybe the culture of CMAR a bit more, maybe any tips and tricks that the more seasoned provider might be able to have, they can lend. So just a nice option built into our orientation schedule. There's also free mental health services through our organization for providers who would like to use it, as well as Phil mentioned earlier about all provider meetings. Even though it's been going on for like 30 years, I really do view that as like part of the wellness program. Of course, like you have the clinical didactic presentations that are part of it, but really the networking piece, learning about the CMAR culture, learning about the various services, there really is a value to that. And really, providers consistently walk away from these meetings feeling very energized. So I think that's definitely part of the wellness program feel. Also too, just offering very CME offerings. I think we have 2, 3, maybe 3 regular CME offerings, and for basically clinical topics presentations that we have. And this is a nice way to maybe engage providers in being active in CMAR presentations, but as well as it helps them just to meet their the CME requirements. But I think too, going back to what Patty mentioned, and like the role variety, people actually really enjoy presenting at these, and we actually use for most of the things we have our CMAR providers. We feel like really our providers have a lot to offer, and it's nice to basically showcase what our providers know. All right, next slide. Okay, so probably what you all really want to know, is it working? Especially in 2019, when developing the wellness program, like one of the questions, explicitly asked was, should one of the focuses be on reducing turnover? And the explicit response from the C-suite was no. Really, we want you to focus on wellness, provider wellness, and that's it. So while not our priority for wellness program, we actually have seen a significant drop in turnover since implementing the wellness program. So that's been nice to see. So again, we view it as like a byproduct, but it's obviously it's nice. Still mentioned with all of his work and transitioning to a new EHR, EHR satisfaction has really skyrocketed. I think it was like maybe 6-fold or something like that since it was in 2019 when we had a different EHR. In 2021 and 2022, when I think you all know when the national burnout rate was extremely high amongst medical providers, our burnout rate was thankfully notably lower. So again, I think our wellness program helped maybe cushion the blow of the pandemic. Maybe that's a way to think about it. Over time, definitely notable increase in satisfaction with clinical leadership as well as organizational leadership. But again, we don't want to discount the anecdotal and just look at the objective. I think just getting the feedback from providers about these various things are helpful. I know like Patty collects feedback from our various preceptors and faculty members about their involvement in training programs, and that rural variety has been very helpful. Providers like the Mills newsletters, sometimes all provider meetings. And you can just by talking to providers, like you can see that some things have been helpful for them. I think one thing that's been helpful too is just in general using the, as Phil was mentioning earlier, survey. It does nice to identify and measure strengths and weaknesses in the medical department. And so maybe think about it, like without the survey, each person has their perception about maybe the truth about why things are challenging or not challenging. And there's really, like to each person, there's a grain of truth at that. There's also something to be said about, okay, we see that, just make up a number, 60% of people are satisfied with their in-basket management. Okay, maybe we can still improve there. Or maybe time spent charting, that's not great. What can we do to help improve that? So you really get, for by and large, most providers, their perception about various areas, so you can best focus maybe your time and efforts on improving the things that will give you the most bang for your buck. Basically, instead of just trying to put you to the ground, not saying you shouldn't, I think you should, you also get another way to make that determination about what warrants most of your efforts for improvement within the organization. And of course, that helps makes maybe meetings more efficient just because you spend less time on figuring out what that focus will be and more how do we address this particular thing that seems to be causing a problem and what really the root is for this particular problem. Let's see. And I think, of course, we have this year's burnout survey results yet. However, we have not shared them with our medical providers, so we didn't feel comfortable sharing that with you all first without telling our medical providers. So maybe view that as a teaser if NAC ever wants to have us back. So we'll tell you then. All right, next slide.
All right. So what did it take to institute our program? I mean, I think compared to the talk yesterday that really highlighted a specific strategy, I think our goal was to talk about a lot of different things that we're doing. And so I think what CMAR has done to do all these different things just takes a lot of different pieces and a lot of different pieces over time. Obviously, the health center leadership is a huge part of that. As Phil talked about earlier, using the survey data over time, being very methodical about what we're asking for, and being less reactive to feedback, and also doing our homework and talking to our colleagues at other community health centers about what has worked in those clinics. Reviewing the relevant data, which is sort of what I just mentioned. Having a staff champion has been huge. So having Tyler as our wellness lead, and using his set of skills that really involve a lot of project management skills, because it takes a lot of communication, like interpreting the data that he's getting and interpreting it and really compiling it in a way that makes sense, and being able to kind of sift through the extra data, but then also having somebody who's a champion of it and believes strongly in it to continue to advocate for it and work towards it, I think has been really important. We have regular meetings in different ways to talk about program development, and I do think meeting fatigue is real. I think we can definitely have too many meetings where it feels too much, but I think when you have a staff champion like Tyler, who can really set an agenda, keep us organized, keep us focused, those meetings tend to be very productive. And having different types of meeting with different team members involved, from smaller scale clinic level to larger scale organization level to talk about themes, I think has been really helpful. Our resident wellness program, which I think is great, of course. We know what we do with our program, besides the whole residency of training, folks to practice in our setting, but really taking a lot of the things that are challenging about our job, in addition to the clinical work, and helping residents build skills to work through those. So things like vicarious trauma, and how to have those difficult conversations, and how to react to a situation when somebody's de-escalating, and building those types of skills early in our career, when you could say they're more malleable, right? You kind of develop good habits from the start. I think we've seen it to be helpful in keeping our residents long-term in community health, even if it's not at CMAR, but keeping them being able to practice in the setting that's so challenging long-term. Our external partnerships are super important. I think meetings like this where we can learn from each other, so we don't have to reinvent the wheel. And then being creative and mindful about how we're developing new systems and policies to work through things. Recently in January of this year, we had a big change where our provider schedule template changed, and that was many years of work in progress to be able to make that happen. And I think just being very thoughtful and methodical about when we do make changes, that they're good changes.
Yeah, and I just wanted to add out here, I don't think it was seen, but in terms of getting buy-in, and all levels, the AMA's, I don't really tell you remember the title of the program, AMA's recognition program, which Tyler has been very good about, because both it informs a structure for our wellness program, but also, it involves some sort of reporting back to them and meeting measures to get a certification. Having that certification, I see as part of it, reinforcing the buy-in on an organizational level. I think our leadership is proud to have that certification. They don't do it to get the certification, but it definitely is a positive reinforcement. So I just wanted to mention that as well. That definitely has value to getting the input and buy-in.
Thanks, Phil. Thanks, Floyd.
So maybe a few of our lessons learned since doing this for the past 6 years or so. You can't say that everything we've done has worked or has stuck. I think maybe kind of one of our approaches, of course, I told you all that we kind of tried to adopt what other organizations are doing, but also just kind of taking a shotgun approach, just kind of being thoughtful about it, but trying a bunch of things, but some things don't work. And it's again, that kind of views this as like a quality improvement process. And if you try something that doesn't work, okay, then stop doing that or tweak it and try it differently. Whatever situation warrants. Take a look about things that work really well at one clinic and disseminate it if possible. This might be just this could do going back to maybe for example, our applying best practice for medical directors. Really, this is where like a medical director would be able to maybe have something down pat, like maybe phenomenal clinical quality measures in their clinic, and they want to share with the other medical directors, this is what we're doing so you can borrow from it. Obviously, that's not necessarily a wellness program focus, but that kind of is the methodology, one of the methodologies that we use. Where you can look for some low-hanging fruit. Keep key stakeholders engaged. I think, again, one of the big ways we do that is through presenting our survey results literally each year at all the levels within our organization. So everybody down to the providers that completed the survey, all the way up to your board. They're aware of the provider's perceptions, recognize the importance of it as well. But I think another one that's important to consider is don't promise things that can't be delivered. It would be phenomenal to say that if you just make a wellness program, all of your challenges will be solved. And I digging into the literature as well as our own experiences talking to others that make a wellness program, I have I, I just don't see that occurring. Like basically it can help. Obviously shared data that suggests this can definitely help. But there's no suggestion that it's a cure-all. No, think about like if in medicine somebody was talking about that, maybe like what in an appendectomy for appendicitis, that is like if you do this one thing, it's solved. Well, yes, of course, take out the appendix. That's great. But a lot of things, no. It's like, okay, this medication will help 1 out of every 5 people, 1 out of every 8 people, or 1 out of every however so many. It doesn't help everybody, but you can be more or less effective. It's kind of the same thing with this. Like, doing wellness programs, good. It's not going to fix everything, but try to make your wellness program as effective as possible to help as many providers as possible. It's one thing to consider. All right, next slide.
So, and just advice for other health centers, and just to segue onto what Tyler just said, in terms of promising things, and a message that we try to give, and I give, is that being a healthcare provider and an FQHC it's hard work. I mean, there's a reason we call it work. And so don't ever pretend that we can make this not hard. And I know that sounds bad to say it, but a part of a wellness program is not to say, oh yeah, we'll make the needs of our patients go away. That it's how will we support you in doing what we can to help meet the needs of the patients, and being straightforward and honest about that. Yeah, this is a really hard part of this, and we know it's hard. We share the experience of how hard it is, and we're trying to think about it and wrap our minds around making it better. And in that context, you want to reach out to other organizations and see what they're doing and how they've done things else. So we've had a lot of interaction with some other organizations about EHR, practice management skills, and seeing other people and how they do things. So we are not the only FQHC in the world, as you all know, since you're on this forum, and everybody's work is work. And so learning from each other is very important. And as Tyler said, you just got to try some things. If they don't work, you roll them back and be honest about what we are trying and what didn't work. And probably, again, that patience thing is a huge part of have advice, because part of promising things that can't be delivered, it would be promising quick change. And so I've been a lot at CMAR for a long time, and there are things that it take years to develop and get through as you gather more perspectives, learn more, all the nuances for the different parts of something. That a lot of the things that are pain points for a reason, because there's not a simple answer, right? The low-hanging fruit is one thing, but some of the other stuff doesn't have simple solutions. And so knowing that we're looking for a solution and trying to understand it thoroughly so we can look for solutions, but also being patient about that rather than saying, oh yeah, we're going to fix this problem, because it just takes time. And that engaging providers in that is about the honest and open communication. This is where we hear you. This is how we see it, and trying to really keep us all on the we're all together, as opposed to an us and them dynamic, where the provider's like, this is my world, and administration doesn't understand or doesn't care. And getting providers engaged with your wellness program really has a lot about breaking that dichotomy down. Likewise, the mindset change, which I see, it goes both ways. So the mindset change for providers is not to have the us and them thing, but for administrators is to, likewise, our administrators can have an us and them. The clinicians just want to complain about this or that, and both sides, when we get together and talk about respect for each other as colleagues and wanting everybody in our work environment to enjoy their work and feel effective. And that's kind of the core values of the idea of wellness. It's a much better place to shift the way we think about the challenges we face. And I think that's last slide, question time.
Thank you, Phil. Thank you, Patricia. Thank you, Tyler, for this very inspiring presentation and covering all the details and addressing so many drivers of workforce wellness. Michelle and Mariah, were there any questions submitted that we may have missed in the chat?
And I'm so sorry for coughing. I do not see any questions right now, but I did want to ask of just how often, so we talk a lot in the STAR Center about doing these surveys, going directly to your staff, of ensuring, I really believe so much of the cornerstone of well-being is understanding how to properly communicate and have that transparency. And my apologies if this had been mentioned, but how often do you really do these surveys? Or do you find that there's a cadence that works better when you're, with providers and their limited schedules and things like that?
We do ours once a year, usually around March, April, May, somewhere thereabouts. And I think we really felt that doing it more than once a year be survey fatigue, but doing it once a year, we have a great response rate. So clearly providers don't feel like it's too much. And it's nice to do it yearly, because if you do it less frequently, it's a hard time seeing if some of the changes you've made have helped. If you do it yearly, it's at least you have more immediate feedback to see if some of the things you've made have helped.
Perfect, thank you. And do you also provide the opportunity for the same type of feedback for other individuals in your health center outside of those who are providers?
We do have a survey for everybody. It's an AHRQ survey. I forget the specific name of it, but it's adapted to our setting. It's not specifically on burnout, but does get at a lot of facets that are helpful in promoting team-based care, feelings of respect and safety within the organization, but it is a different survey. So right now, our wellness program is just for medical providers. There's talks about expanding it. This is just where we're at right now.
Perfect. Thank you for that. And I did get one question on the part where you all were talking about the EHR and how you modified it. And the person is just asking, like, when did you make that decision to do a modification rather than a standard one?
We have monthly kind of governance meetings around EPIC. And so we have a structure where we encourage local leaders, whether it's the clinical director from a clinician point of view, or whether it's a nurse manager or a health center administrator, to put in a request about a change. And then monthly we meet with the kind of builders and analysts to see if that change is doable or not doable, and if there is a more elegant way of doing things. And so it's kind of on a monthly cycle. It's interesting because a lot of times, and it's gotten much better, but early on, we found a lot of those requests were about training. So someone's like, I want to know how to, spell the letter and you're like, oh, well, we can teach you to spell the letter and. We don't need to build something to do that. So as trainers, that really informed our trainers and made our training program better. And now we don't get nearly as many of those type of requests.
Wonderful, thank you. And Katja, I see you put a question in the chat, and Katja was just asking, how often do you meet as a wellness team with Tyler as the wellness lead?
You kind of think about this, like, for example, Phil mentioned, of course, improving our EHR is like a part of the wellness program, but I would frankly be useless when it comes to that. And so I don't attend those meetings. Phil is phenomenally good at it. And so, perfect, let Phil, I don't keep Tyler out of Phil's way, in other words. But for example, some of our wellness meetings that we do have, like Patty and I are on what we call a wellness task force. Maybe a way of thinking about it is keeping our ears to the ground for providers, as well as familiar with this the survey and how to maybe craft proposals based on the feedback in the survey and make proposals to the administration. Maybe that's one way of thinking about it. We meet monthly for that, but I also meet with some other members of our administration monthly as a part of our wellness program. So we kind of maybe working out a little bit, but it seems to work, and so that's what we've been doing.
Yeah, so per your initiatives that were highlighted as opportunities, right? Like the EHRs with Phil as a physician lead, the role variety that you shared about Patricia and leadership development that was both of you, I think, or maybe all three of you together. That was great. The provider support. Yeah, I like how you are working on the opportunities throughout and continuously.
And I think it's worth saying it's just the nature of our organization is probably the nature of most community health centers. But it should be explicit that you need clinicians who are doing the job in your
Yes.
wellness team. You can't be an
Yes.
strictly administrative point of
No.
view. And
Yeah.
that's, I think for a lot of us, that's obvious, but it's definitely got to say it.
Yeah, thank you, Phil. I think that's actually an excellent point to end this webinar on. Yes. And it goes back to the communication, of course, the importance of that, and the culture, the wellness culture that you are nurturing so beautifully, like with your really network of supporting each other, and each other, your workforce, but then also having such amazing patient outcomes.
Just to piggyback off what Katja was saying, and Phil, you as well, I think you bring up a really critical point of ensuring that the right people are also there. Actually, this morning I did a training on well-being, and one of the things talked about, and I think Yakima did amazing with this yesterday, and you all doing the same, is talking to the people who are involved in this. Like, what do you need? What can we provide you to really make your lives better, in the organization, and really letting them have that seat at the table. So I agree, not just only having administration, but also the providers, the people who are doing that day-to-day work. Katja, I'm not sure. I think we have one. Oh, it's just the thank you slide. So I wanted to make sure to go on there.
Yeah.
I do want to say in a moment, Mariah is going to have the evaluation pop up. So if you all could please fill that out. And I know, Katja, I'm going to pass it back to you in a second, but I just wanted to say a huge thank you to CMAR. The presentation was absolutely excellent. And then yesterday as well, another thank you to Yakima. But Katja, if you want to close us out.
Yeah, I'll say thank you as well, especially to our team. Thank you, Tyler, Patricia, and Phil, and thank you, Michelle and Mariah. And we will stay in close touch with everyone who joined us today and or registered for the webinar with follow-up information, the slides and resources. And we know that some of you may also pass it along for other colleagues to listen to the recordings. So thank you so much. It's been a true pleasure, and have a nice rest of your day. And on the East Coast, please stay cool. Best wishes for that, and take very good care. Thank you so much.
Thank you, everybody.
Bye. Bye-bye.